Okay guys, so I'm in the car line and got some time, so figured I would start on the full version, the full facts of this case from front to back, beginning to end. You know what I mean. With the Alexee Trevizo case, I'm going to discuss not only the facts, try to look at both sides, but then talk about the problems and where this whole thing is going to go and why I stand where I stand. For those who don't know, I did see a few comments and some other content creators comment section asking, why I got to the conclusion that I did. So we have a 19-year-old girl who is an active cheerleader. We know that she was gaining some weight, was consistently getting a period based on the information that we have from the medical records. The last couple of months before this incident, her period was a little out of sorts, and she was actively bleeding on the day of this incident. She was taking some phentermine, which is basically weight loss medication. And according to her and the family, nobody had absolutely any idea that this young woman was pregnant. So on the date in question in January, she goes into Artesia General Hospital and is complaining of severe back pain. Now, I want you guys just to picture this for a moment. According to the medical records, according to the doctors, according to everybody else, she's in so much pain that she's basically pacing the floor, complaining of back pain. Now imagine this girl standing there, touching her back, walking around. It hurts, just pacing, holding her back. I think any person off the street could have looked at this woman and been like, oh, this girl's in labor. But apparently the medical staff couldn't. So they do her vitals, blood pressure's high, heart rate's high. The triage nurse, Chris, is like, okay, I'm a little concerned. Let me get the doctor. Doctor comes into the triage area and starts to attempt to examine her. And then, I guess, can touch her lateral back. Whether or not she touched the belly is up for debate. She says she did, then she says she didn't. But she is blaming Alexee for her not being able to touch her back, or touch her belly. But then she says she did. Regardless, at some point during this, Alexee abruptly leaves and tries to go to the bathroom. They had put in a request for a urine analysis. She was unable to give them one. Doctor goes and puts in some orders and orders that Alexee be actually moved right away to an exam room. They move her to an exam room. They take her blood. They give her an IV, and then they give her some medicine, ketorolac, morphine, cyclobenzaprine, and some Tylenol, and some saline solution, some IV fluids. Now, at one point, Chris says that she finally relaxes, and is able to, I guess maybe the pain sort of lessens up or whatever. And she's now in this hospital room, for about 48 minutes. During this time, they have received the blood work back, and they're like, okay, this girl is pregnant. Doctor's like, okay, with the amount of pain that she's in, let's go ahead and get a quantitative test. Let me see the levels of hormones so I can determine how pregnant she is. She goes ahead and puts in those additional orders. 48 minutes go by. And at this point, Chris comes into the room, and Alexee's like, I really feel like I have to have a bowel movement, and I just can't, I have to go. He disconnects her IV, and she bolts to the bathroom. And mind you, now at this point, Chris knows that she's pregnant. The doctors know, the CNA knows, the charge nurse, everybody knows, and nobody has yet to come in and say, hey, she's pregnant. Mom now goes to the door, checks on her daughter, wants to make sure she's okay. Some time goes by. Mom comes back to the door again, and she's like, are you okay? It looks like she's asking her if she's okay. She's knocking on the door. We don't know what was said and what that conversation looks like. But Mom is the only one who checks, and it looks like maybe at one point Mom may go and get the nurse or something, because then finally her nurse comes in. Mind you, her nurse knows that she's pregnant. At any time, they could have been like, listen, your daughter's pregnant, or if they couldn't release that information, even though they did everything else in front of Mom, the doctor could have been like, she's pregnant, she's in there, what's going on? But still, nobody had checked on her for a while. Then finally, at the end, a few minutes before she does come out, we see, Chris kind of lollygags in the hallway. Her nurse comes and kind of starts doing, not really checking on her, but just kind of hanging out there. Talks to some nurses at the nurses station, goes back and forth. 5 minutes before Alexee, when Alexee's been in that bathroom for about 14 minutes now, doctor comes in. Doctor's like, hey, listen, I guess she's realizing now she's got the quantitative back. She's realizing now that this is a fully pregnant woman or girl, I'm sorry, and this is not a, early ectopic type thing. So she goes and she's like, listen, we got to get her out of there. I think at this point the doctors probably realize, oh crap, something's going on. We have a pregnant female. She's been in there for quite some time. She's very pregnant. I need to get her out. I need to do an exam. They attempt to get her out for just a couple of minutes, and then Alexee finally opens the door. She'd been there for 19 minutes. They open up. They see it's not a bloody disaster, but there's some smears on the floor where it looks like she was trying to clean up the bloody mess. According to the staff, they go in there, they look around, they look at the garbage cans, they look everywhere else, and according to everybody else, nobody sees anything. One nurse is claiming that she's specifically looking to see if anything was left behind. She doesn't see anything either. So Alexee gets escorted back to her room with the doctor, and at this point, the doctor is like worrying about her patient bleeding out. She is bleeding profusely at this point, and she can't even see what's going on. There's so much blood. She tries to evacuate it. She's getting a bunch of clots. She doesn't have the right ultrasound machine. She's ordered an ultrasound for an ultrasound tech to come in, but at this point she tries to use the little probe, which I think is more for like arteries and different things like that, and she's trying to do whatever she can to see if she can figure out what's going on, and she doesn't really see anything. She evacuates some of the blood. She tries to do an internal exam and realizes that, hey, wait a minute, this girl cervix is wide open, full 10 centimeters. She's wide open. What's going on? Maybe she's having a miscarriage. I believe she knows pretty much how far along she is based on all the results that she's got back, but let's just go with that. At this point, she's baffled. She can't seem to figure it out. And then we have some other things that are happening outside at the same time. So I'll go into the next part. Right now, we've just kind of covered the care that Alexee was getting, or lack thereof. Remember now, nobody's come into that room for a significant amount of time. I want you guys to also consider that when she ran to the bathroom, she had the ketorolac, she had the cyclobenzaprine, she had the morphine, all of this stuff in her system. And on top of that, she was massively bleeding. Now, if you don't know, do a simple Google search, and it will tell you what happens when somebody is suffering from severe blood loss. Altered state of mind, confusion, disorientation. There's so many things that happen. All of this is going on while Alexee is in the bathroom. The next part, we're going to go into what happens in the bathroom and then also what the staff does after that.